Good evening, all the aspirants present here. So, today is our first session of General Topic CCS session, and the speaker that we have here is Dr. Fathy Elshazly. He is a specialty registrar in Northwest Deanery, NHS, England. Thank you, sir. So, you may continue.
Okay, thank you so much for having me. Um, Thank you, Fatma. I'll start sharing now. Could you see the
Yes, sir.
presentation?
The slides are visible. Just put it in the slideshow mode.
Okay, you can see it now?
Yes, sir, you can start. And so many other
Okay,
students will be also joining us. And all the
okay,
aspirants, it's an interactive session, so you can also unmute your mic or you can type your question or any doubts in the chat box. Thank you. So you can start.
yes, thank you so much. As mentioned by Fatma, this is supposed to be an interactive session. To get maximum benefit out of it, I ask you kindly, I cannot see your names at the moment. I only could register three, Stani, Arsha, and Salah. If you don't mind, just unmute your microphones and if you can open your camera so that can be some sort of interactive session, because if you are not going to interact, the benefit will not be so much from this kind of scenario. As you know, the EDIC exam contains is being run over 2 days. The first day is computer-based scenarios with just slides, about 10 slides in biochemistry, 10 slides in radiology, and 10 slides uh, in curves, whether ECG or ventilator curves or TEG or ROTEM, and those kinds of computer-based questions are the most difficult actually, because you have to answer a lot of questions in a short period of time, and then you have to at least pass 2 stations out of 3. Regarding the second day, which we are going to practice today, is the clinical case scenario, where you are going to have 2 short cases and 2 long cases. And the 2 short cases, every case takes about 20 minutes, and the long cases, everyone takes about 40 minutes. The examiners are going to take you into a journey from the time you encounter the patient until the time they being discharged from the ITU, or God forbid, the time they die. If the patient dies or deteriorate during the exam, don't get panic or anything. This might be most probably the scenario itself, because actually the process of death or end of life care is a process that you are being examined as well. They are going to assess how we are going to deal with the patient in this situation, and how we are going to deal with the family in this situation as well. So because there is no communication part of this exam, they are going to assess your communication skills and your approach to a patient who is dying or end of life care. In purpose, I did not announce or the case of which we are going to discuss today, because we're going to discuss a lot of aspects, from whether resuscitating the patient, what are we going to do in admission to the patient to reach the proper diagnosis, and how we are going to treat the patient properly, and during his journey or length of stay in the ICU. So I would really approach if you can engage with me in this scenario, because if you are not engaged, because this is all about the practice. The EDIC exam is not an exam just to assess your safety and if you have practiced ICU or not. Those kind of courses are not going to teach you ICU from scratch. The information and knowledge, I know it is there. I know that most of you have been practicing ICU for a longer time, but this exam is only about how safe you are according to the European standards. Um, so let's start. Could anyone please volunteer to read the scenario, if you don't mind?
18 years female who's been unwell for 3 weeks with bumpy swellings around neck, nodes around the neck and behind the ears, pyrexia more than 38 degrees Celsius. Visited outpatient department, treated as glandular fever, advised some rest and hydration, was given paracetamol and some spray, felt better going to school, college. 2 days ago started feeling tired or lethargic.
Okay.
Admitted
continue,
to
please.
emergency department into the medical ward and was treated as probable viral infection. You are asked to assess the patient due to hypotension requiring multiple fluid boluses, increased respiratory distress, 94% on NRBM, 15 liters per minute, decrease in the level of consciousness, GCS 14 out of 15. What are you going to do?
So what are you going to do? What's your name, sir? Sorry, Stani or Arsha? What's your name, please?
I'm Dr. Priyanka. So I
Priyanka,
would like
okay.
to resuscitate the patient. I will take care of the airway, breathing, and circulation. And
Yes,
so I'll take
continue.
care of the airway, breathing, and circulation. So if the patient is not maintaining the airway or reduced level of consciousness, then I'll put a mouth gag or some similar device to open the airway and give oxygen. Try to maintain saturation above 94%. And then circulation, patient is having reduced blood pressure also. So I will give fluid boluses and maybe required. I'll like to start with vasopressors. I will prefer noradrenaline over vasopressin. Um, and also,
Okay. Okay, so what kind of fluids are you going to give to the patient? And what's the dose?
so I'll prefer crystalloids over colloids, preferably balanced salt solutions over the normal saline. And I would, my resuscitation will be individualized as per the patient, and I will be guided in my fluid resuscitation by the measures of fluid resuscitation. And so I'll measure echocardiography and measure the cardiac output with the help of echo bedside focus. And then I will like to look at VTI, and my fluid resuscitation will be guided by changes in VTI.
Okay, so what are you going to do next with the patient then?
Because this patient is also having respiratory distress, so I'll because NRBM is not good, so I will like to put either the patient on HFNC or non-invasive ventilation. I'll prefer HF, high flow nasal cannula, over non-invasive
Okay,
ventilation, and
okay,
maybe I'll
great.
try to give a trial.
You are still on the medical ward. Are you going to continue treating the patient on the medical ward?
No, the patient requires ICU admission, definitely.
Okay. How are you going to ensure that she's safe to be transferred to the ICU then? Hello?
How? Yeah, yes, sir. How to
Um,
ensure patient is safe for the transfer? Uh,
mhm.
because this patient requires vasopressors and the respiratory support is also required. So this cannot be managed in the ward setting. So patient requires the ICU admission. We also have several scoring systems like Quick SOFA score, Muse and News, early warning scores, which help us to guide regarding the ICU admission policy of the hospital. So this patient
Great,
is
great,
having
great.
GCS low, so neurological system is affected, respiratory system is also affected, and plus hypotension. So cardio, three systems are being affected in this patient. So that definitely the patient requires ICU admission.
Okay, so great. You mentioned she requires ICU admission. So the issue that we are going to reassess again after the interventions you have done to see if the patient will be safe, whether the blood pressure has been stabilized, the patient not in a peri-arrest status, and he can be transferred safely to the ICU or ITU. Especially that the nasal high flow, usually most of the devices with the nasal high flow at the moment don't have internal batteries. So either you are going to use non-rebreather mask or NIV in order to transfer the patient and do what's called a checklist for transferring the patient and get a senior help if needed, okay? And of course, if they ask about what kind of help you are going to ask for, then the next question will be either from a colleague or senior colleague or from an outreach team or the outreach nurse or outreach team. Great, Priyanka. Obviously, you are very acquainted or very familiar with the system in Europe and in UK, especially because actually now the questions are being more more like have a British some sort of a British kind of questions because obviously the British obviously have some sort of dominated the exam process for pragmatic and logistic reasons. So to ensure that because most of the aspirants of EDIC are usually go to UK or Ireland. That's why and the exam is in English. So that's why the European Society of Intensive Care usually now use British examiners a lot and the British kind of questions. That was great, actually, Stani. Thank you so much.